Hello and welcome. This is a instructional video on how to give naloxone for our country fair family. So what is an opioid? An opioid is a drug that can cause euphoria, take away pain, but also causes respiratory depression, slowing of breathing, and when you stop breathing, it could cause cardiac arrest and death. Fentanyl, oxycodone, heroin, morphine, Vicodin, Dilaudid, and methadone are all opioids. But why are we concerned about fentanyl? It's because fentanyl is 50 times stronger than heroin and even 100 times stronger than morphine. So it takes micrograms to have an effective dose. It's often added to other drugs unknowingly to people, and so that's why an accidental overdose is pretty common. How does naloxone work? Well, the opioid receptors in your brain are triggered when opioid is bound to it, but naloxone is a competitive antagonist, which means that it bumps the opioid off of the receptor and allows the receptor to not work anymore, thus reversing the overdose. When should you give someone naloxone? If you can't wake someone up by talking, then shaking them or pinching them hard, or they have a limp body, they have slow or shallow breathing, or they're not breathing at all, their lips or nail beds are turning blue, or their pupils are small or pinpoint. So you've determined that someone needs naloxone. Now what do? Well, the most important thing is to get help. You need to alert Whitebird about your location and information about a person being unconscious and unresponsive, and see if anyone around you can help you, specifically either to go get someone to radio to Whitebird or to help you find the naloxone if you don't have any with you. And then you can administer. But it's very important that you get help on the way because no one will come and help you unless you tell people you need help. So this is a trainer, but the naloxone will come basically looking like this once you get it out of the package. You're going to hold it between two fingers like this and the thumb on the plunger. You can go up to the person once you've made sure that they actually need the naloxone, and you're going to insert it into their nose. You don't have to cover the other nostril. And then you're going to firmly press down on the plunger. And you're not waiting for someone to take a breath because you don't need the medication to get to their lungs. It's actually absorbed up in the nasal mucosa. And so that's why it will work with someone who's not breathing but still has a pulse. And lastly, some important things to remember. Naloxone only works on opioids. It will not work on other drugs. You can give anyone naloxone and it will not affect them unless they have taken an opioid. And when you give naloxone, it just reverses the opioid so that they can breathe again and not overdose. It can take more than one dose to get a response, especially because fentanyl is so potent and you don't know how much fentanyl could be in the drugs. And after someone has been given naloxone, they need medical attention. They need to be monitored because sometimes the naloxone will wear off faster than the opioid, and they may need repeat dosing. Alcohol can make the opioid overdose more likely, and no one is too young to be trained on how to give naloxone.